Hello, my name is Bria Thompson, and I am going to discuss how, even when it comes to public health, humans still have irrational behavior. So, we know that smoking is bad for us, but still, 1 out of 5 deaths in the United States are still related to smoking cigarettes. Although we know that we can get cardiovascular disease, lung cancer, and other types of diseases from smoking cigarettes. So, why do we still make the decision to smoke cigarettes? And of course, we know that tobacco is addicting, but I just want to explore how there are some subtle nudges that some countries use to promote better habits. Tobacco was actually brought to the United States back in 1612 in the colony of Virginia, and it was actually the first grown crop, which became the primary source of revenue. Back at that time, the 13 colonies actually used the money from tobacco to help overthrow the Great Britain authority, so they can become their own nation during the American Revolution. The use of tobacco then expanded to other people, but wasn't initially used as cigarettes. It first started with pipes, chewing, and enrolled cigars. And it wasn't until 1865 when a man named Washington Duke actually took the tobacco, rolled it in cigarettes, and gave it to soldiers at the end of the Civil War. After that, there was a cigarette machine which could produce 120,000 cigarettes per day, created by James Bonsack. James Bonsack and Washington Duke's son, James Duke, actually combined both of their business ideas to produce 10 million cigarettes the first year that they collaborated. And that was actually the start of mass cigarette production. Later on, the first tobacco company was named the American Tobacco Company, which the owners were Washington Duke and his son James Duke. Cigarette sales actually increased significantly. I'm sorry, cigarette use actually increased significantly during the wars. The World War period, so from 1914 to 1945. Not only were men smoking, the soldiers, but also the women were smoking because ads actually started to appeal more to women. In 1923, 45% of the U.S. market was actually dominated by Camel brand cigarettes. And then by the time it was 1960, 42% of adult users smoked cigarettes. At this time, it was just more of a social thing. No one really saw any of the health risks associated with smoking. However, it was not until 1964 when it showed that smoking was connected to a lot of deadly diseases. And one main disease, of course, would be lung cancer. Um, some of the other risks, as I mentioned earlier, were cardiovascular disease, respiratory disease, and other diseases. And smoking, although it has declined since the 1960s, is still a prevalent issue today. As I stated earlier, 20%, nearly 20% of deaths in the United States are related to smoking cigarettes. But this isn't a unique issue to the United States. Smoking is actually a concern all over the world. It's such a huge concern that major organizations actually have been trying to take part in certain initiatives to decrease the amount of people that smoke. So, one in particular, the World Health Organization, has actually developed an initiative called the Global Tobacco Free Initiative, and it has 6 components called Empower. So the M stands for monitoring tobacco use and having prevention policies. The P stands for protecting people from tobacco smoke. O offers to help smokers to quit smoking. The W warns people about the dangers of tobacco, and then E enforces bans on tobacco advertising, promotion, and sponsorship. So I am going to go through some few laws and initiatives, and some of these laws and initiatives were before Empower, but they might have influenced Empower. And I just want to show how not only the World Health Organization, but also how other countries are being what we call choice architects, which is a term from the book Nudge. And a choice architect creates an environment to encourage people about making decisions. So everyone is a choice architect in some way. And I also want to display how these countries and the World Health Organization are also displaying libertarian paternalism. And libertarian paternalism nudges humans to make rational decisions without banning the irrational choices. So, again, I'm just going to go through a few laws and initiatives really, really quickly just so I can show how these principles are displayed. So, in the United States, one way that the United States has actually tried to influence the behavior to stop smoking was by first implementing a law called the Federal Cigarette Labeling and Advertising Act, which first came about in 1965. And this act was supposed to require tobacco companies to put warning labels on cigarette packages detailing the health related risk associated with smoking. So, although that this was a step in the right direction, the Federal Trade Commission realized that this was not really that consumers weren't really responding to this. This wasn't having any effect on people to slow down on smoking. So then they amended this act and then added that the warning labels just need to have stronger messaging, and also banning cigarette advertising on any use of electronic advertising. So this simple thing right here, this simple law right here, again, is not banning the choices of people cannot smoke. It's just not trying to promote these choices and instead trying to say, hey, here are the risks associated. You need to know these risks. In other countries, something that they tried to do were implement graphic warning labels. And actually, the first country to implement this initiative was Canada back in 2000. So, graphic warning labels are basically a pictorial image of body parts or teeth or somehow how smoking affects a certain body part. And Canada put these on their packaging. And Canada did see a decrease amongst young adult smokers by 20%. So showing that this simple nudge on the packaging decreases smoking. Another thing that was implemented was in Australia, and Australia was actually the first country to implement this, and it was called the Cigarette Plain Packaging Law. So in Australia, the cigarette plain packaging law require all tobacco companies to have the same color on their cigarette box. So it was like a dog, not too attractive green, and then have some type of graphic image of a body part affected by disease, which smoking can cause, or how babies are affected by their parents smoking. And the only thing that's similar on all these boxes are the brand of the cigarette producer. So they also did see the objective to this was to see a decrease in smoking because it decreased the appeal of smoking. And then the last initiative that I want to talk about was actually talked about in England. And what England wanted to do, since they were already banning public places from smoking, so certain restaurants, certain government places, not all places, but some places, they wanted to encourage people to not smoke in their homes or in their car because secondhand smoke also has the same deadly effects as if a person themselves were smoking the cigarette. So the initiative was that there would be community ambassadors to recognize positive behavior when people stop smoking inside of their homes or a car. And they actually tested it out in Manchester, and over 400 families that committed to stop smoking in their homes resulted in 1,500 children avoiding the health risk from secondhand smoke. So these few initiatives that I discussed are evidence of nudges in the environment that have helped with tobacco control. And there are many other initiatives, like, for example, raising the taxes on cigarettes, um, and also what is on the warning label, certain commercials that are against smoking, that try to influence the behavior of humans so they can stop smoking. And it is um, proof that simple nudges do change behavior, because smoking has declined dramatically since the 1970s. And hopefully, with people continuing to promote how irrational behavior this is, one day we will be at a rate where 100% of people do not smoke. However, we're humans.